Hello, students. This week we'll be focusing on chapters 7 through 9 of the Right Crisis and Trauma Counseling. What I'd like to do is just say this up front to bear in mind all of the things that COVID brings to this. So when we look through these crisis interventions, crisis causality, we want to continue to keep in mind the CDC guidelines, face masks, social distancing, and consider high risk groups. We're going to approach those differently, and we're going to observe protocols of the CDC guidelines so that we're not exposing others to COVID. So I just want to have that in the back of your mind as we go through these chapters. So let's go ahead and jump in. You will notice that I also am, we're covering a lot less reading each week for the remaining weeks of the term. That's because we're kind of in the meat of this thing now. And a lot of you are going to be exposed to material that you may have never had before. I want you to be able to really take in the information. So here we go. So crisis and trauma, what's the difference? The difference is that a crisis tends to be more of a turning point, while trauma leaves behind a scar, and that actually can be shown in the brain. So we're focusing on crisis at this time. There are four elements of a crisis. First is a hazardous event. So bear in mind, any type of loss can be a crisis. It can be the loss of a job. It can be the loss of potential career. It can be a grief loss. Just keep in mind that the 6 weeks that we'll talk about later on before the situation stabilizes, that continues on with grief for two years on average. The other part of a hazardous event can be a disruption. You may have a college student who's an athlete with hopes maybe going pro, and they suffer an injury that shuts off that opportunity for them. Those are things that are a disruption. It's not a threat to life, but it's definitely a crisis event. There's the vulnerable state. So what we're talking about is the event is only as much of a crisis as is the emotional event and the potential to be hurt. So there's a vulnerability there. If it doesn't mean something to me, then it's not going to lead to a crisis. And you'll want to keep in mind how much of an emotional investment does the counselee have in this particular disruption or loss? How much is it going to affect them? And different people will be affected in different ways. The precipitating factor is basically what we call the last straw. So it may be, you may have had a series of events leading to that turning point, that last straw. Fourth is the state of an active crisis. We're going to see symptoms of stress, physical and emotional. A person who may not have had any kind of heart condition before may see signs of blood pressure. They may have gastrointestinal issues, ulcers, loss of appetite, gain in appetite, and you will have symptoms of emotional stress. And a reminder to turn off my ringer. Okay, back to our PowerPoint. The second state of an active crisis is the attitude of panic or defeat. You will see a person who's very active, very high energy, suddenly turn inward and go silent. You may see someone who does the very opposite and actually begins to have behavior that's very much out of character for them. You may see self-medicating behaviors, overeating, alcohol use, drug use. So all of those things are shouldn't be shocking. And as long as there's not a danger issue, you want to just try to step back and allow some space for the person, and not be so shocked by the behavior. Now, self-medication clearly is not an answer, but in the moment, it may not be the time to say, "Are you sure you want to drink that?" So use your wisdom and read the situation and the person, and make sure, of course, safety above all else. You're going to see them focus on relief. You'll see, this can't be happening. Why would God do this to me? There'll be acts of desperation. They may reach out to someone that they wouldn't have reached out to before, or act in a dependent way that you may have never experienced from them. All of these things are in the moment. So just be aware, and just give them safe space to act out on their emotions if they need to. Sometimes it'll be focused on you. You may be the emotional punching bag. So this is the moment where you've got to, if you've done the proper self-care up front, then the person is going to, they'll even out. If you've done the proper self-care, then you can stand up and take a punch or two. There's a time of lowered efficiency. Even the top performer that is going to be in a position where they have no energy remaining. They are completely depleted and don't have inner resourcefulness. Does that mean that they don't have resiliency? No, it doesn't. What it means is they are reacting appropriately to the stressor. Okay, continuing on. And this one, I'm going right along with the text. So follow along with me. I hope to just enhance what your reading has, especially since we're in the much less volume of material to cover. I want to cover it more in depth. So balancing factors. We're actually into page 131 of the text. Balancing factors. So what you want to do is to take into account differences in people and how they may respond to a situation. So you may not expect the pastor to suddenly start questioning God if you're reaching out to someone who's considered to be a person of faith, and someone who's supposed to be a leader. Well, guess what? We all are vulnerable to the same types of reactions. So always with a dose of grace, right? Now, we want to look for factors that will help to strengthen them. And so play up to those personal factors if they have a strength. But also, as one of my mentors always says, healing cannot happen outside community. And so when a person is isolated and in crisis, it's when they are at their most vulnerable to the enemy. And we tend to ruminate and settle into dark thinking, when we in fact, and even some may turn away people that reach out, but encourage the person in crisis to to seek the support of their friends when we're poor self observers and we're poor self evaluators. And I see again and again someone saying, I shouldn't be this upset, I shouldn't feel this, I shouldn't say that. um, and people around them who know them will be able to say, you're one of the kindest people I know, and of course you're going to feel um, upset, and you're going to feel pain in this situation. Um, and they're going to know that person and know their strengths, and they won't say things that are, if they're good support, they won't say things that are um, unrealistic or just trying to flatter. Coping mechanisms. So uh, we talk about utilization of coping mechanisms. What we're talking about is a healthy use of defense mechanisms. Now, go back earlier this term, we talked about defense mechanisms. And when you are facing a crisis, the initial knee-jerk response is that denial. No, it can't be. Um, that can be a very healthy response in a situation, because it allows me to sit back, try to take in the shock, and try to sort through, is this real? So some of those defense mechanisms initially, and as we mentioned before, actually help with survival. It's the extensive use of defense mechanisms. And of course, the coping mechanisms that Wright goes through in the text that are unhealthy, um, keep those in mind. Limited duration. So, what we're looking at are events that are not the scars like trauma, but more the turning points. Okay, so I've experienced this job loss. What next? Is it time for me to take a new course? I've had this breakup of this relationship. What is my next path? And what you're looking at is for uh, typically up to 6 weeks for the person situation to stabilize emotionally, physically, and that's got research to back it up as well. Okay, so life transitions. This is kind of one that, we talk about the 5 top stressors. You may hear this in pop psychology, but in fact, these are very significant. New roles. Okay, so you may find a new role in the job situation. You may find that you go from a person to a parent. You may find that you become an empty nester. Uh, what does this mean for the marriage now that we're not focused so much on the kids? The next thing is a move, geographical change, another top stressor. Socioeconomic changes, loss of income, or, how many of you have read about these lottery winners who just implode with the sudden wealth? Physical changes. Here's one for me. I really want to go back and do some jujitsu, but I don't think my shoulders or my gut are going to allow me to do that. And so there's kind of, okay, I don't mean to make light of that, but as a person ages, they're going to experience loss of mobility, loss of energy, um, or even some onset of illnesses. Those come as crisis as well. Anybody at any age, when they get the cancer diagnosis, um, that's a life changer. And then the person who's had that diagnosis, even if they've had a good outcome, spends the rest of their life looking over their shoulder, waiting for its reappearance, because you've kind of broken that barrier. Now I've I'm a survivor. I'm not just a person. Now I've had this and I'm a survivor. And survivor has got a positive connotation. But for the person who is a survivor, you'd rather not have that label. Now, midlife crisis. This is debatable in the psychological research community. There's not a great deal of research to support this as a syndrome or a diagnosis. But I can tell you from personal experience that you do need to take this into consideration. Um, you know, from my experience, it's more likely to come from an existential fear rather than the culturally influenced Western culture of aging and glorification of youth. Although those, certainly can be factors. I think when you consider, you come to a point, and if you ever get interested in this, Kohlberg has phases of spiritual development, uh, and let's see, yeah. So we think more about our end. And a friend of mine, he went around, he teases us when we hit certain age markers, and he calls 30 the meet Jesus curve. So you've topped the hill, and now you're on the meet Jesus curve down. So um, funny, but not so funny. That's there's really something to that, because people start to question, what meaning has my life had? Have I been pleasing to the Lord? Um, did I ever make my parents proud of me? There were some questions that, is it too late? Now, I'm going to be politically incorrect here, and I'm going to tell you that it's different for men and women, particularly in Western culture. So, for men, their identity tends to come from their intrinsic self worth for rather than occupation. So, if we're working with men, they've got to see themselves as not what they make or what they do, but rather than they themselves. So self worth as their identity in Christ. That not what do you do, who are you? Helping men with acceptance and expression of authentic emotion. If you ever get the chance and watch the documentary called The Mask You Live In, it's on YouTube, and pay the $6 to watch that. It's incredibly valuable to talk about how men in our culture have been pushed to hold stereotypes. And as a friend of mine said, men are only allowed to feel lust and anger. Men also need deep and strong male friendships. And of course, as always, foundation in God's Word. For women, their identity needs to come from self worth rather than through relationships, roles, quality of service to others, giving, because we are human beings, not human doings. And these go either way. Male, female can place their worth in occupation, possessions, quality of relationships. So, try to encourage the balance that you are fearfully and wonderfully made. With women, acceptance and expression of wisdom. Encourage them to be deeper, and that they have contributions to make with intelligence and wisdom. And, interestingly enough, I've been in professional discussions groups, and I would throw out an insight, and people would say, wow, yeah. And then a few minutes later, it would be attributed to my male counterpart. That's happened to be more than once. So take women's wisdom seriously, especially for this class, right? Females need strong, deep female friendships besides their, a significant other or a partner. And again, foundation in God's word. So keep those in mind and encourage those when we're looking at self worth for people. Okay, personal factors of the counselee. So these are some of the variables to take into account when you're working with someone. Wright has 14 categories. These are fantastic. I probably need to make a poster and put that on my wall. So the 14, when a person is in crisis, they're going to have different needs. And so you're going to go in being mindful of what this particular person may need. It may be something completely different from what you expect. So when you've got a person who wants a strong person to protect them, please take over for me. For someone who feels empty, care for me. For someone who needs someone to listen and provide security and be faithful, be there for me. Take away my guilt. Let me just get it off my chest and vent. And bear in mind, keep in mind that the venting process can turn sour. When you've got somebody telling the situation of what's happened, allow them to express that. Stay engaged with active listening and allow them, when it starts to repeat, try to turn your radar on to say, okay, is this them trying to make this thing real in their own minds, or are they now trying to get something else? Why are we repeating the story? Why are we repeating this theme? What's under the surface with that? So keep that in mind. For coping poorly, look at these things and apply abundant grace. So when you've got somebody who may not be as strong as you think they should be emotionally, emotional weakness, put yourself in their shoes. Not everybody is going to respond to a punch in the gut the same way. Not everyone is going to take it, like that if you've done your self care and taken one of those punches like we talked about earlier. Not everybody's conditioned for this. If they're in poor health, that's going to deplete their resilience. If they're avoidant of pain and they want the pain to go away now, or if they don't want to deal with it and they push it away, delay, be aware of those things. Again, all of these are actually on page 139. So when you're talking with the person, they're not going to tell you what the label is. What you're going to want to do is go in from an informed stance and listen. Is this actual appropriate self-defense? Is this response out of poor coping skills? And if it's from poor coping skills, how can I kind of cushion that and maybe turn them a little bit more towards, instead of blaming someone, well, if that doctor hadn't done such and such, or well, yes, I didn't show up for 3 weeks in a row at work, but things were really chaotic. You're going to go, okay, I understand. So things have been really difficult for you. So this isn't the time to preach, but it may be the time to slow the descent and try to get them to reflect. Okay. That's really nuanced. I get it. You're like, how do you know that? Well, if you've done your work up front, your own internal work and your self-awareness and seeking wisdom from God, I think you're you're probably more gifted than you realize. So, if you're coming in blind and you don't know about the person that you're going to be ministering to, try to get as much detail as you can. For my husband being a pastor, he oftentimes was called in to do funerals or even hospital visits with people who weren't members of the church, maybe were just a relative of someone. So he would always do whatever he could to learn about that person as much as he could before arriving on the scene. So try to find out as much as you can, and that can give you kind of a baseline of what's going on with the person, and if in fact the behavior that you're seeing is non-characteristic. Um, and that can help you to be uh, better informed in how to respond to them. Take into account emotional, social, physical, and spiritual health of the person prior to the crisis. So if you say, well, I know they pray sometimes, but I don't know really what they believe. Well, you're not going to go in there, with blazing guns and Paul, right? Or James. You're going to come in and say, okay, tell me a little bit about what's going on with you. Is prayer something that helps you? You find strength from that? Can I help you in prayer? If they're in poor health, you know, being gentle. So learning what you can before you arrive on the scene, if at all possible. And on the flip side of that is if you know this person really well, uh, keep in mind, this is one that I like to say to counselees a lot, is let God write the end of their story. You're not the one to write the end of the story, it's God. This right here would be worth memorizing and having at your disposal at all times, uh, maybe even printed up on a card, or if you're really radical and you're really into this, a tattoo. Okay, don't you young ones, don't tell your moms I said that. Uh, so crisis from a Christian perspective, this is golden. Being a Christian doesn't exempt a person from all crises. And I can't say this to some of my family members, but I would love to say God ain't Santa Claus. A crisis isn't a crisis to God, meaning not that he doesn't care, but that he is the overcomer. And he can turn a crisis into something beyond we could ever ask or imagine. God comforts and promises to be present. We have to evaluate how trusting is this person of God. And if they are trusting of God and they're asking why, I don't know, but I just know he's here. You don't have to have the answer. Here's a crisis will not last forever. And a person of faith who's got a pretty significant biblical background, if you can say, okay, this is so hard. I can't imagine how hard this must be for you. Um, do you think this may just be for a season? You don't tell them this will just be for a season, because then you're just giving advice, and that's not what they need right at the moment. And hope resides in crisis. So if you can turn them to, okay, this is a major change for you. You don't know what's coming, but I know that you're a person of whatever their giftedness may be. I know that I have seen God work in your life. Or if it's someone you don't know, um, people tell me that you've always been a help to others. I would be willing to guess that you will again have that desire in your heart to help others. So you find strength, you find a place that is meaningful to them. Okay, the phases of a crisis. So, the first thing that happens in crisis is when the brain uh, switches to survival mode. And we'll go into this more deeply in the trauma section, but we're talking about thinking capacity. When you are hit with shock, you're gone from analytic ability to just reactivity, because you're in a state where I have to respond in order to survive. If I stop and analyze, I will not survive. So prefrontal short cortex is not fully engaged at this point. Um, think about the lost object, whatever the loss was. If you've lost that opportunity that you had hoped for, maybe as in a particular career path, or I've had a couple of U of L athletes who were on their way to the pros football, and injury shut that door for them, and that was a major loss for them. Um, Great guys, great guys. So they're going to be this desperate search of it. Maybe if I have more surgeries, maybe if right there's a desperate search to reverse the event. Um, I mean, you yourself have just uh, done this. We've all done this, where you go, oh, that can't have happened. That must be wrong. I'm not getting the right information. This can't be true. So there's some kind of built-in desire to try to reverse it, to try to go back in time. Then there's guilt, and this is where you're looking at someone who's caught up in the bargaining phase. If I hadn't had done this, if only I hadn't done that, or it should have been me, or maybe I can still go back, blah, blah, blah. We've all done this too. So this is where you're kind of turning to, this is the point in which you may want to intervene and say, I wish that could have happened. I wish that could have happened. Or if it's something unrealistic, uh, I know that you want to make this, to take this away. I know you don't want this to happen, but you didn't have that power to make this happen or not happen. I don't know why this happened, but I don't think that it's your fault. You can't take on this. This is not something that you had the power to change. And read the counseling. If they're, if only I had, I know, it makes sense that you would feel that way. Normalize it. It makes sense that you would feel that way, but deep down that's not how it is. If you know the person, they may not know. Okay, withdrawal confusion. So you've got the emotional turmoil, confusion, fear, exhaustion, pain. Every ounce of emotional and spiritual energy is expended in this. So this is where we want to be a calming presence, and also to help them know that they're understood. So this is where we, in the kind of couples therapy I do, when someone's at a loss of describing something they're feeling, you can offer empathic conjecture. Could it be that you're not thinking clearly, or is it that you're feeling just devastated right now? This must feel so overwhelming. Is that what it's like? Ask them, what is it like for you? And if they can't explain it, it's too much for words. I just understand it. It's too much for words. It's just too much. You're actually giving them words by doing this, and they're feeling, okay, you do understand. You are there for me. There's nothing like feeling understood and that you're not alone in that. Extra support. So this is where I've seen it over and over again where there's a death in the family, church comes, brings food, pastor's there, um, you know, does, supports the family, does the funeral, does the graveside, and then that's it. Nobody's there to observe it's been a month or, you know, gosh, a year ago, this was when you had that terrible accident. Um, you know, don't just hit it and forget it. And don't make this a teachable moment. Oh, yeah, well, you know, of course, this is God's going to use this for something. Um, yeah. And so observe anniversaries, check in, follow up, and take them out for coffee. Spend some time down the road. In a crisis, we're talking 6 weeks. In grief, we're talking years. Yeah, I'll get back on my high horse with grief. Okay. Next thing is good organization. This is where the practical comes in. If let's say they've had a tornado take out their house. I don't know what to do. What do I do next? Okay, let's get you to safety and make sure you're okay. And then we'll come back and we'll see what can be salvaged. Right? Let's get you safe first. And they may be wanting to rush back in, that kind of thing. Are you okay? Everybody's okay. Thanks be to God for that. We're going to come back. Can I call somebody for you? If I'm going to go turn off the gas line to your house so there's not a fire. Just practical things that they're not going to be able to think of at the moment. Okay, self-pity. Hold on to your hats, folks. This is where I go into soapbox mode again. This term, self-pity, is universally overused by people trying to feel superior. Wright's point about self-pity is that you help counselees avoid self-medicating, and that means more than just substances or alcohol. Help them to avoid self-medicating so that they can feel their feelings. If you don't feel your feelings, it's going to be, remember the chicken in the microwave? It's going to be like that. You've got to express, release feelings, and don't have them make any kind of major decisions right out of the gate. They may try to inappropriately or prematurely replace what they've lost. And here's one for you. Never, ever, ever use the phrase, they're feeling sorry for themselves, or I'm feeling sorry for myself. It's you're feeling pain. You need to express it. Now, if you're shutting down or pushing people away when you need it, when you need someone, or when you need to process something, that's different. But this thing about feeling sorry for yourself, folks, that is a way that you will injure. Those are words that do not build up. Those are words that tear people down and are never helpful. If they could get over it, do you think they would? Yeah. Okay, so how do we do this? And I want to throw in another reminder. Keep the COVID protocols in mind. You may not be able to hug somebody. This is frustrating beyond belief. We all know this. But if you are counseling, keep it simple. Don't preach, don't lecture. Keep it very simple. Simple words, simple phrases, very basic. And I've got here, ask experiential questions. what are you noticing when you think about this situation? What do you experience when you talk to this other person and who's experienced the same loss? What are you guys sharing together? What's happening inside you? Again, maintain a calm presence. You've done your upfront soul care. Patiently allow the counselee to set the pace. And again, allow for the repetition. Remember, if it's rumination, um, you can let that go for a certain amount of time, but watch for signs of something else that they may be needing in this repetition. Um, this is a point where maybe you're trying to take it back. You're trying to reverse history. Maybe you just need to rest right now, or maybe I'm tired of hearing, but I need to keep my mouth shut and continue to listen. This is when you're prayed up going in and you're listening to the Spirit of God. Okay. Uh, Verbal effects. Don't say, oh, honey, it's going to be okay, or, well, at least it wasn't, right? Be curious and caring. Say more about this. Tell me what's happening. I can't imagine what this must be like. Can you tell me what's happening for you? Slow down. Be comfortable with silence. Use active listening. Use empowering statements. Like I said, finding a person's strength and reminding them of who they are. How is this person gifted in the image of Christ? If you know these things, make sure and tell them, I don't know how this is going to come out, but I know that you've always been there for other people. Can you let other people be there for you? And have those people, yourself and others, at the ready. Can I give you? I had up here at one of my retreat communities. Um, he made an audio uh, CD called "The Mourners." Uh, it was in after the death of his brother, and I've had that on hand, and I've given that to folks. Music can speak words in a way that we can't. Okay, so assessment. So here are some things to have in mind as you're watching. You're seeing the behavior, and if you know prior personality and prior behavior, then you've got a baseline to determine, okay, how serious is this? How far over the top is this? Something maybe does this person need to be hospitalized? Are they thinking of hurting themselves, or is their physical health such that they're taking risky um, they're taking risks they shouldn't be taking? Affective functioning. So, um, is the grief so, is the sadness or the fear or the anxiety so overwhelming that they can't function? Well, I've got to go back to work. I've got to go back to. No, you don't. No, you don't. I had one of my supervisees take the National Licensure Board exam. Be 2 weeks now. She said, "Well, I should be able to get done with this exam, and I'm going to come to our supervision meeting." I'm going, "No, no, you're not. No, you're not. First of all, you're going to need every minute of this exam, of the time for the exam. You're going to need every minute. And second of all, you're going to be wiped out when you're done." Oh, but I said, just plan on not being at supervision this week. Just okay. I'll think about that. Well, for those of us who have to go through this board exam, we know you go out of there just knowing you failed. Every one of us, um, every person you talk to, and you know our students pass a lot of the time. So, but the next time I met with her, she said, "Oh, you were so right." She said, "I went back to my office and cried." And I said, "Yeah, yeah." And most likely she's passed. She worked so hard. Anyway, point being, um, have them be realistic with themselves. Okay. So, even if they're saying, I feel fine now, okay, but you want to build in some space for yourself. Look for symptoms. If this person's having a panic attack, watch what's happening there. Um, Ask questions about, what are you feeling, physically, emotionally, spiritually. How are they doing with other people? If you're a customer service rep and you're in a state where you have no patience for somebody else, maybe you should take the rest of the day off. And also look at their thinking, cognition. How clear thinking are they? This is not the time to make a major decision. And so you may want to help them with that. Or they may say, hey, I'm good with this. Um, I'm ready to, you've helped me so much with kind of seeing these things clearly. Let me go ahead and move forward and taking the next steps I need to take with, you know, business or insurance or getting back to work or those kind of things. Uh, take all of these in as you're figuring out how to respond to them. Okay, climbing out. Uh, Help them to reasonably climb out of the crisis um, in a way that is not detrimental to them. Um, so, again, don't give advice, don't offer constructive criticism. This is not the time. Ask thoughtful questions with their permission. Would it be okay if I ask you about what kind of preparation you've made in a situation like this? Um, would it be okay if I call your mother in law? Um, do you want to talk about how this has affected your expectations of the future? When you go back, think about the full version of uh, the the prayer, the Serenity Prayer. It's about them, not the world as you would have it. Don't make this about you. It's if you turn focus from yourself onto them and remain curious, you are way ahead of the game. You're way ahead. Uh, Gain hope. So offer suggestions for possibilities they have for the future. Um, had a client who, on a weekend, she took her daughter to a choral festival that was out of town, not too far. And while she was gone, her husband cleared out their house, took every stick of furniture, took the beds, took forks, pots, pans, everything, cleared out the entire house. And they returned to an empty house without even a skillet. So you can imagine what that was for her and her daughter. But after the initial shock, she said, okay, it's time for me to concentrate on Sue part two. That was part one of my life. Here's Sue part two. What does the future hold, and how can I have a different kind of life? Now, week one, week two, week three, we didn't necessarily go there. There was still the shock phase, the betrayal, and in fact, the husband did this in cahoots with their older daughter. She helped to move out and take everything. So these are the kind of things that you're gonna just say, oh, how could he have done that to your daughter, to you? Um, I can't imagine what you felt when you came home exhausted from your trip and there wasn't even a bed to sleep in. And we knew, and we both watched her cues to see when was it time to talk about part two of her life. Um, so you know, read read the roadmap ahead of you. Listen to your intuition and pay attention to that basic outline. Reconstruction. So When again, this is not just a one and done. So as you're walking through with this person, be constantly vigilant of the positives that pop up. It may be the simplest little thing. I noticed that you updated your calendar. That, you know, you're that's that's a positive sign. You're looking ahead. That took a lot of strength and courage. Um, just notice little things. Um, so you went to the gym yesterday. That's the first time you've been in a long time. That's fantastic. Um, and they say, well, oh, it's not that. Wait a minute. Yes, there were a lot of people at the gym, but how many of them have gone through what you just went through? Point out that they need to be aware of their own inner experience and monitoring that, and realize that you're going to have ups and downs, and that's normal and that's okay. That means, you know, that you're still processing this thing. It's still, you're still coming through it. There's still work happening under the surface. um, Point out changes in their spiritual and emotional growth. It's really, really helpful, because they'll say, well, yeah, I did better than last week. And you go, but wait a minute. It's been a month. Think about where you were a month ago compared to today. And they'll say, could you have done that a month ago? No, I really couldn't. This is amazing. This is incredible what you've accomplished. Sometimes you have to, the gradual change isn't so obvious until you say, go back a month, go back to, right? And even go back to before the crisis. I'm seeing things in you now that I've never seen in you before. Or ask the question, if you don't know them well, what are you noticing about yourself today, that wasn't there before all of this happened? And be ready for, a left curve. They may say, well, I'm a lot more cynical than I used to be. Yeah. Yeah, but I've also noticed you have a lot more compassion to people that have been through the same thing, right? Okay. Implement immediate intervention. So this is keeping a triage mentality, being prepared to jump in where you need to. Um, and if you come onto the scene in a crisis situation, be prepared for interruptions, and you know just kind of be ready for workarounds. Use sustainment techniques. So right after the event, uh, these are meant to give a sense of stability in the situation for the counselee. So making sure that they have support system around them, making sure that their physical and emotional needs are being met right away, and keep in mind those 14 types of counselees. If you look at this person, is this the kind of person that wants to feel secure in the moment? Is this a person who's looking um, to just feel safe? Is this the kind of person who just says, I just can't do this. Can you please just take this? So be aware, and have some options at your disposal. Um, BIP, basic intervention procedures. These address the turmoil, offer social support, and bring some directive components to the confusion. Uh, you know, Prioritize in your mind. Okay, first of all, the person's safety. The next thing is the person's physical needs. The next thing are the emotional needs. Go down the line. Okay, and so taking action, again, keep in mind the assessment, the basic assessment. Take into account any prior crises that they may have already had leading up to this one that could have worn down their resilience. Again, same thing as at the beginning. It can have a cumulative effect. Look at the communication skills of the person. Um, they may not be able to express themselves. They may not have words. Allow for that. And you can do some empathic conjecture in that kind of situation. I don't know what I'm feeling. I don't know. Okay, well, we know that right now it's bad, and that's all you need to know. You don't need to express any more than that, unless they actually want to understand better what they're feeling. And then you can walk alongside them with that. Perception. Okay, the size of the event in the context of their experience and their personality. You know, I never was going to be a ballerina, but if there was a young lady that had the training and the build for it, but didn't make the cut, um, I'm not going to sit back and say, well, at least you're skinny. You've got to say, this was a dream. This was the loss of a dream. I take myself out of this thing and I say, well, you've got your health. You got no, don't minimize it. That must be so devastating. I'm sure you envisioned yourself on that stage, right? I mean, I don't know. You may be laughing now. I don't know, but that's that's a dream. Don't minimize that. Don't project your own perceptions onto it. Um, you may need to take on a leadership role in the moment. Okay, let's just wait over here until the paramedics have checked you out. Uh, I'm going to sit with you. I'm going to pray with you. We're going to wait, or whatever. Uh, you're going to offer support that way because they're not thinking clearly. They may be still in that crisis moment, whatever the turning point was. Don't violate laws like, um, it's okay. Um, I've had a CPR course or whatever. Uh, don't take on something you're not qualified to do. Um, of course, in an emergency situation, that's life or death, but that's another conversation. Okay. Um, Work to avert catastrophe and restore the person to a state of balance. This may be where you have to run interference between well meaning church members and the counselee. Remember again how I mentioned the stupid things people say at funerals. Um, let's say that someone has suffered a drug overdose. Well, the first thing somebody's going to say, I didn't know they were a drug addict. Well, maybe it was just an accidental prescription overdose. You don't know. Um, well, I heard that she was telling people blah, blah, blah. You got to shut that stuff down. Say, can we just can we just keep this quiet until you know the facts? Or can you just step out because you don't have any say here? Yes, church member, pastor's wife. There's a little bit of what we call countertransference going on here. Fill in the gaps in the information. If somebody's saying, I heard that he lost his leg in that accident, you go, wait a minute. His leg is badly injured, but he's not going to lose it. Can we just wait? Fill in the gaps. Um, and the other thing is, you may have 20 people from the church that want to run to the hospital. If your counselee says, I can't handle a bunch of people right now, then you yourself or you delegate somebody to get the word out that um, they want their best friend and their aunt to come and wait to hear from them. Meanwhile, they've said it's okay for you to get the prayer chain going because guess what? The prayer chain, they may not want the word on the streets. And that's, as we know, it's a godly gossip chain. Okay, foster hope and positive expectation. So offer positive alternatives without being unrealistic or giving false hope. So, like my client, when we were talking about Sue Part 2, I wasn't saying, oh, you'll find a better guy. Or, oh, this is your big chance, but just to say, maybe this is a time for you to get to know yourself better and really pay attention to some things that you felt you couldn't do when you were in that relationship? Yeah, I've always wanted to do, to do crafts or quilt or, skydiving or whatever. Say, yeah, I mean, that's something that you haven't had the opportunity before. Maybe this is a time to explore some new things. Um, Maybe skydiving might not be advisable. I don't know. Depends on the person. But give genuine encouragement based on a positive view of the counselee. And I'm going to grant you, you may have some folks that have been in your congregation that haven't been functioning well for a long time. And they say, oh, well, that's just Joe. He's this, he's that. This is where you got to go. All right, it's time for me to see through God's eyes. What does God's word say about giving someone a place of honor and someone else, right? What is this really about? What I see is a person who is fearfully and wonderfully made, and God is going to write the end of their story. Ongoing support. So check in. Give generous access in the beginning, but you move away from them so that they are able to get more support from the people in their support system, small group at church, whatever it happens to be. You don't want to build dependence. So instead of the personal visit, maybe we need to switch to a phone call. Maybe we switch to a text. We're assessing as we go as to how well they're doing, and we're inviting them to seek out those other resources for themselves. As a therapist, my job is to teach someone else to be their own therapist. If they don't already have a circle of support, help them to find one. Direct them, encourage them, and if need be, direct them to family therapy. Again, the CUL clinic is here to help, and no one is turned away based on their financial situation. Focus on problem solving. Help them to brainstorm their own goals. Don't impose your own. You've got folks that say, I want to be a rock star. Okay. Don't poo-poo on that. Say, okay, if you set your mind to it and you work hard, go for your goal. Rockstar might be a stretch. That's another discussion. I'm just thinking about one of my kids. Be sensitive to current values. So again, as it's not a time necessarily to give constructive criticism or advice, know what their values are, and maybe you would put more of a priority on them spending more time at home with their family instead of their career. That's when you got to step back, because then it's about you again. Help them select a course of action. What are the next steps for you to reach your dream? Help them to face the problem. Okay, now that the dust is settling on this thing, what are some ways that you can recover from this? What are some things you can do to address the problem, whatever's happened? And help them to monitor their emotions, their feelings. If you cannot name it, if you don't own it, it owns you. So make sure they're aware of what they're feeling, and that's our emotions are a gift from God, just as our intellect is. Give generous grace to themselves and to the people around them that are trying to help, or that may be a part of the problem. Understand and assess self-image. Now, if a person has a poor self-view, then they're going to have less resiliency. They're going to have less motivation because there's a lack of hope, or they may feel they don't deserve to hope. On the other side of that, maybe if they are too prideful, they may go off into unhealthy self-defense mechanisms. Well, they've always had it out for me. I'm this and I'm that, and they just are jealous. Okay, well, let's get a reality check in here. Now, the next thing is avoid labeling. Remember again, well, Joe, he likes blah blah blah, he likes that, he does this, he does that. You don't know the future. And this is one, if you've had one of my classes before, if you apply one concept to every situation, you're a lazy thinker or you're legalistic like a Pharisee. You can't put somebody into a neat category because only God knows what is best for them. And so, while we can't be unconditional in love or positive regard, we got to be intentional about being as close to that as we can. And Wright says you need to believe that the counselee has value, worth, and the capabilities, and at the present time is simply overwhelmed by their difficulty. And still self-reliance. Now it's time for positioning them to take the wheel again, assign responsibility. So, and even if they've never been responsible before, let's say you've got a person who's lived with their parents their whole lives, and the parents can't afford to live with them anymore. They're moving, and guess what? You got to find a new place. Um, Crisis is a turning point, and that can be a positive. So the turning point can lead to positive change. Deal with the emotions at hand, your own, because you may be projecting something, as well as theirs. If you're shocked at a new experience of the person, you're the one who needs to expand your thinking and analyze why this is bothering you. Maybe they've had a breakup and they've met somebody new in a very short time. Now, I, as a therapist, am going to tell them, hey, there's a grieving process when you end a relationship. And then in 2 weeks, they meet somebody. You know what? This could be God's person for them. God doesn't do it the same way every time. It's time for me to step back. Help them cope with a new role. So let's say that this person has gone from being a parent with kids in the home to an empty nester. Help them envision some new opportunities, aspects of the role that are going to be positives, as well as some bumps in the road they're going to hit. Any role will inevitably include both the positives and the negatives, regardless of the situation, while we are still on this planet. So just help them to be grounded in how they start this new role or this new direction. Okay. That's all I have for today. So, again, we're digging in a little deeper with less material, but we want to be able to incorporate these things into ministry. So hang in there, and I will be seeing you guys next week.